Welcome to The Explainer. Today we're going to talk about something that's often invisible, the journey a person takes when they're trying to get psychiatric help. We're going to pull back the curtain on this, using insights from a medical lecture to really understand the obstacles a patient is up against.
So, what do you think is the toughest part of seeing a psychiatrist? You'd probably guess it's, getting the diagnosis or maybe dealing with the side effects of medication. But according to our source, the real challenge, the biggest hurdle, actually starts way before a patient ever sets foot in a doctor's office.
That's right. For so many people, the hardest part is everything that happens before they even walk through that door. So let's dive into this. We're going to follow what the source calls the patient's journey, a path that honestly can feel like a really exhausting and confusing maze.
So why is it the last stop on the journey? Well, in a word, stigma. Instead of going straight to a psychiatrist, a lot of people who are dealing with psychological distress end up on this long tour of other medical specialists because they're convinced their problem has to be purely physical.
A patient can literally bounce between doctors for months or even for years. They're looking for answers to very real physical symptoms. We're talking headaches, stomach pain, even hair loss. And this leads to a whole battery of expensive and a lot of the time totally unnecessary tests, all while the root psychological issue just goes completely unaddressed.
And when modern medicine doesn't spit out a clear, physical answer, the journey can take an even stranger turn. Patients are sometimes told that their problem isn't medical at all, but spiritual, that maybe they've been envied or cursed, and that sends them down a whole different rabbit hole of sheiks or spiritual healers, delaying proper psychiatric care even more.
But, okay, let's say our patient finally gets through all of that. They arrive at the right place, the psychiatrist's office. This is where the single most important part of healing begins, and it's not a prescription, and it's not a diagnosis. It's a relationship.
And let's be clear, this isn't a friendship. It's a professional, structured, paid-for relationship that's designed for one thing: healing. The strength of this bond, this feeling of trust and safety, it's the absolute bedrock of the entire process. It's what determines if a patient is going to stick around or just walk away.
But what happens within that relationship is just fascinating. You see, these powerful, unconscious feelings can pop up between the patient and the doctor. And here's the thing, they aren't a distraction. They're actually a core part of the therapy itself.
It's called transference. It's a totally natural thing where the patient, without even knowing they're doing it, projects feelings about important people from their past, very often a parent, right onto their doctor. The therapy room kind of becomes this stage where old, unresolved stuff can get reenacted and hopefully understood.
So a patient might, for example, say something just like this. They might feel this white-hot anger at their doctor, not because of anything the doctor has actually done, but because the doctor unconsciously reminds them of a controlling parent from their childhood.
And it's a two-way street because doctors are human too. They can experience countertransference where a patient reminds them of someone from their past. A really skilled therapist is trained to spot these feelings, both in the patient and in themselves, and use that awareness to keep the relationship professional and focused on the patient's healing.
Okay, so a diagnosis is made, a plan is in place, now we hit the next huge hurdle, actually sticking with it. The official term is compliance, or maybe a better way to put it is treatment adherence.
And adherence is just absolutely critical because this kind of treatment is almost never a quick fix. To stop a relapse of a first depressive episode, for example, a patient might need to stay on their medication for a year and a half or even 2 full years. That is a massive commitment. So you have to ask, what makes someone want to stop? Well, patients often walk in with a really deep distrust of psychiatric meds. They're scared they're addictive, they're worried they'll be stuck on them for life, or that the side effects will turn them into, as the source puts it, a zombie.
But the patient's own fears are really only half the battle. They also have to fight against this constant storm of outside opinions from well-meaning and sometimes not so well-meaning people who can completely throw their progress off track. The source calls this a chorus of 100 million muftis, which basically means 100 million self-proclaimed experts all giving you advice you never asked for. It comes from family, from neighbors, from the pharmacist, and of course from Dr. Google, where every medicine is just one click away from a horror story.
And the advice can be just that casual and that devastating. The source tells this story of a patient who was told by her neighbor, while the neighbor was literally stuffing zucchini, "Don't take that medicine. It will ruin your brain." And the real irony? The lecturer points out that the neighbor giving this scary warning might be secretly taking the exact same medication herself.
The stigma is just everywhere. Even the simple act of filling a prescription can become this moment of shame. The patient feels that look from the pharmacist, that judgment. A look you just wouldn't get if you were picking up medicine for a heart condition or for diabetes.
And this stigma has huge real-world consequences. The source raises a really tough ethical question. In a small, tight-knit town, if a young woman's name is on a psychiatric prescription, could that information get out and just ruin her chances of getting married? It's so serious that some doctors even admit to bending the rules, maybe putting her father's name on the script instead, just to protect her privacy and her future.
So what's the big takeaway from all this? The path to mental wellness is so often blocked by barriers that have nothing to do with the illness itself. It's a maze of misdiagnosis, social stigma, and just a ton of misinformation. And what that tells us is that fostering a supportive, understanding, and non-judgmental environment is every bit as critical as the treatment itself. The final question for all of us then is, how can we help clear that path?